Right now, before you finish watching this video, I want you to take off your shoes and socks and look at your feet, because what I'm about to show you could save your life. Your feet are one of the most honest parts of your body. They cannot lie. And for people over 60, your feet are often the first place your body sends warning signals when your blood sugar is dangerously high. Not your blood test, not your doctor's office, your feet. Before any other symptom appears. My name is Dr. James Carter. I have been a physician for over 22 years, and I have seen patients come to me with advanced diabetes, patients who had no idea their blood sugar was out of control because they simply didn't know what to look for. Today, I am going to show you 7 specific warning signs in your feet that indicate your blood sugar may be dangerously elevated right now. If you have even 3 of these signs, please see your doctor this week, not next month, this week, and stay until the end, because I am also going to tell you the single most powerful food that reverses these symptoms naturally. Most doctors never mention it. Let's begin. Look at your feet. Let's see what they're telling you. First, let me explain why your feet are the earliest warning system for blood sugar problems. When blood sugar stays elevated for weeks or months, even slightly above normal, 2 things begin to happen simultaneously. Number 1, your blood vessels are damaged. High glucose acts like tiny shards of glass inside your blood vessels. It scratches and inflames the inner lining of every blood vessel in your body. But the smallest blood vessels, called capillaries, are damaged first. And where are the smallest, most delicate capillaries in your body? In your feet, in your toes, at the very ends of your circulatory system, the furthest point from your heart. So when blood sugar rises, the feet lose adequate blood supply before any other organ. Number 2, your nerves are damaged. High glucose is toxic to nerve fibers. It damages a protective coating around nerves called the myelin sheath. And again, the longest nerves in your body are affected first. Which nerves are the longest? The ones running from your spine all the way down to your feet and toes. This nerve damage is called peripheral neuropathy, and it is one of the most common and most devastating complications of uncontrolled blood sugar. In the United States alone, over 50% of people with diabetes develop peripheral neuropathy. So your feet feel pain, tingling, numbness, because both blood supply and nerve function are being destroyed simultaneously. This is why your feet are the alarm system. Now, let me show you the 7 specific signs you need to check right now. Sign number 1, tingling or burning sensation in your feet or toes. This is usually the very first symptom. You might feel it at night, a strange buzzing, tingling, or burning feeling in your feet when you're trying to sleep. Some people describe it as pins and needles that never go away. This is called sensory neuropathy, and it means the nerve fibers in your feet are being damaged by elevated glucose right now. The medical term is paresthesia, and it is not normal. It is not just poor circulation from sitting too long. If it is happening regularly, especially at night, it is a red flag. What to do? Check your fasting blood sugar first thing tomorrow morning before eating. Normal is below 100 milligrams per deciliter. Pre-diabetes is 100 to 125. Diabetes is 126 and above. Sign number 2, numbness in your feet. You cannot feel touch, temperature, or pain normally. This is more serious than tingling. Numbness means the nerve damage has progressed further. Here is a simple test you can do at home right now. Take a pencil. Touch the eraser end gently to different spots on the bottom of your foot. You should feel it clearly everywhere. If there are areas where you feel nothing, or where it feels muffled and distant, that is peripheral neuropathy. The danger of numbness is not the numbness itself. It is what happens because of it. You cannot feel a cut. You cannot feel a blister forming. You cannot feel a small wound getting infected. And in people with uncontrolled blood sugar, wounds on the feet heal extremely slowly because poor circulation means less oxygen and fewer immune cells reaching the area. This is how diabetic foot ulcers develop. This is how 60,000 amputations happen in the United States every single year, from wounds that started as something tiny that the person simply could not feel. Sign number 3, your feet are always cold, even in a warm room, not just slightly cool. Cold. noticeably colder than the rest of your body, cold even under blankets. This is called peripheral arterial disease, or PAD. It means the blood vessels supplying your feet are narrowed or partially blocked by atherosclerosis. Plaque buildup accelerated by high blood sugar. Less blood flow means less warmth. Less warmth means less healing ability. Less healing ability means catastrophic risk from any foot injury. Touch your feet right now, then touch your hand. If your feet are significantly colder, that is a warning sign. Sign number 4, swelling in your feet and ankles, especially at the end of the day. Some swelling after standing all day is normal for anyone, but if your feet and ankles are consistently swollen, if you press your finger into the skin and it leaves a dent that stays for several seconds, that is called pitting edema. In people with high blood sugar, this happens for 2 reasons. First, damaged blood vessels leak fluid into surrounding tissue. Second, high blood sugar damages the kidneys over time. And when kidneys function poorly, they cannot remove excess fluid from the body. That fluid accumulates in your lower legs and feet. Press your thumb firmly into your ankle right now and hold for 5 seconds. Release. If the indentation remains for more than 2 seconds, see your doctor. Sign number 5, slow healing cuts, blisters, or wounds on your feet. This is one of the most dangerous signs on this list. Normally, a small cut or blister should heal completely within 5 to 7 days. In people with elevated blood sugar, the same wound may take 3, 4, even 6 weeks to heal, or it may not heal at all and begin to worsen. Why? 3 reasons working together. 1. Poor circulation means less oxygen delivered to the wound site. Oxygen is essential for tissue repair. 2. High glucose impairs white blood cell function. Your immune system literally cannot fight infection as effectively when blood sugar is elevated. 3. High glucose is a perfect food for bacteria. Infections in diabetic wounds spread faster and go deeper than in healthy tissue. Think back over the last few months. Have you had any cut or blister on your foot that took unusually long to heal? That is a warning sign you should not ignore. Sign number 6. Changes in skin color on your feet. Look at your feet carefully right now. Look for areas that appear darker than the surrounding skin. This can be a sign of poor circulation or early skin damage from glucose. A bluish or purple tint, especially in the toes, indicates severely reduced blood flow. This condition is called cyanosis. Reddish discoloration when your feet hang down that fades when you elevate them. This is called dependent rubor, a classic sign of peripheral arterial disease. White or pale patches indicate areas of completely absent blood flow. Any unusual color change in your feet that you cannot explain deserves immediate attention. Sign number 7. Thickened, yellowed, or crumbling toenails with frequent fungal infections. This one surprises people. But nail health is directly connected to blood sugar. High glucose creates an environment where fungal organisms thrive. Fungal nail infections, called onychomycosis, are 3 times more common in people with diabetes than in the general population. Signs include nails that are thick, yellow, brown, or white, nails that are brittle and crumble at the edges, nails that have separated from the nail bed underneath. Additionally, the skin between your toes. Look for persistent redness, itching, or peeling between your toes. This is athlete's foot, and it recurs constantly in people with elevated blood sugar because the glucose in your sweat literally feeds the fungus. If you have recurring fungal infections on your feet or nails, and you have not tested your blood sugar recently, please do so this week. Now, if you recognized yourself in any of those 7 signs, here is exactly what I want you to do. Step 1. Test your blood sugar at home. A basic glucometer costs under $15 at any pharmacy. Test your fasting blood sugar tomorrow morning, before eating or drinking anything except water. Normal fasting glucose, below 100 milligrams per deciliter. Pre-diabetes range, 100 to 125 milligrams per deciliter. Diabetes range, 126 milligrams per deciliter or higher. Also test 2 hours after a meal. Normal post-meal glucose, below 140 milligrams per deciliter. Pre-diabetes, 140 to 199. Diabetes, 200 or higher. Write down your numbers. Take them to your doctor. Step 2. Check your feet every single day. Wash your feet with warm water, not hot. High blood sugar reduces temperature sensitivity, so you may not feel burns from hot water. Dry thoroughly between every toe. Fungal infections start in moisture. Inspect every surface, top, bottom, between toes, around nails, with good lighting. Use a mirror for the bottom of your feet if you cannot bend easily. Look for any cuts, blisters, redness, swelling, or color changes. Anything new, check it daily. Step 3. Never walk barefoot. Not in your house, not in your garden, not at the beach, not ever. When you cannot feel pain normally, a small stone, a nail, a piece of glass can create a wound you never feel. By the time you notice it, infection may already be established. Wear soft, well-fitting shoes or slippers at all times indoors and outdoors. Step 4. See your doctor this week. Not next month. Not when you feel worse. This week. Bring your blood sugar readings. Ask for an HbA1c test. This shows your average blood sugar over the past 3 months. Ask for a foot examination. Ask about referral to a podiatrist, a foot specialist. Now, I promised you the single most powerful food that helps reverse these symptoms. And this is something most doctors never mention. That food is bitter melon, also known as bitter gourd or Momordica charantia. Bitter melon contains 3 active compounds that work directly on blood sugar. Compound 1, carantine. Research shows carantine reduces blood glucose levels by stimulating glucose uptake in muscle cells, working similarly to insulin. Compound 2, polypeptide P. This is sometimes called plant insulin. It mimics the action of human insulin and directly lowers blood sugar. Compound 3, vicine. Studies show vicine activates AMPK, an enzyme that regulates glucose metabolism in your cells. The same pathway activated by the diabetes drug metformin. A clinical trial published in the Journal of Ethnopharmacology found that bitter melon reduced fasting blood sugar by an average of 25% in type 2 diabetic patients over a 4-week period. How to use it? Option 1. 2 tablespoons of fresh bitter melon juice on an empty stomach every morning. Option 2. Bitter melon capsules or extract from health food stores. Option 3. Slice thin, saute lightly with olive oil and garlic. Eat with dinner 3 times per week. Important: if you take diabetes medication, especially insulin or metformin, bitter melon can lower your blood sugar further. Monitor closely and inform your doctor before starting. Let me leave you with something important. The 7 signs I showed you today: tingling, numbness, cold feet, swelling, slow healing wounds, color changes, and fungal infections. These are not just uncomfortable symptoms. They are your body's emergency broadcast system. They are your feet literally screaming at you, something is wrong. Please pay attention. And the remarkable thing is, if caught early, many of these symptoms are reversible. Peripheral neuropathy in its early stages can improve significantly with blood sugar control. Circulation can improve, nerve function can recover, but every week that blood sugar stays elevated, the damage becomes more permanent. More nerve fibers die, more capillaries close, the window for recovery narrows. You watched this video for a reason today. Maybe your feet have been bothering you. Maybe you just wanted to check. Either way, I'm glad you're here. Now take what you learned and act on it. Today, not tomorrow. Check your feet. Test your blood sugar. See your doctor. If this video helped you, please subscribe and hit the bell. I post 4 new videos every week with real clinical information designed specifically for seniors. Comment below with the word feet, and I will send you my free PDF, The Complete Diabetic Foot Guide, with the 7 warning signs checklist. daily foot inspection routine, and the top 5 foods that lower blood sugar naturally. Share this video with someone you love, because the person who needs to see this most might be someone in your family who doesn't know these signs yet. Thank you for watching. Take care of your feet. Take care of yourself. I will see you in the next video.